Okay, good afternoon. I'd like to welcome everybody to this pep talk this afternoon. As a reminder, please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you, watching the webinar, listening to the webinar. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your beautiful faces in the video. Another reminder, please take the online learning cum evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like this. I have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee or one participant to a voucher for a ROJoson telemedical consultation. Another request that I'd like to make is that please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your faces in the video. Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk in May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on the enthusiasm, discipline, and perseverance of the participants, and also myself included. My pep talk today is entitled Varicose Veins. The empowerment objective is for the lay people to have an essential understanding of varicose veins in their health management. The contents of this pep talk will be the following. What are the 2 general types of blood vessels that can develop abnormal enlargement? What are varicose veins? What are the different types of varicose veins? What are the causes? How to recognize or diagnose varicose veins? And what are the different stages of varicose veins? How does a physician evaluate a varicose vein? So we have to know how they do this. What are the common diagnostic tests for varicose veins? And what are the treatment options for varicose veins? And what is the prognosis? So this will include issues like recurrence after treatment of varicose veins. What are the preventive measures, if there are? And what are some of the myths on varicose veins? So this will be the contents of my talk. I'd like to make a disclaimer that the contents of my talk will contain my thoughts, perceptions, opinions, and recommendations culled from experience of other people, other professionals, and also myself from experience. Let's start with the first topic. What are the 2 general types of blood vessel that can develop abnormal enlargement? Yung paglalaki, okay, ng blood vessels, okay. So the main types are the arteries and veins. Usually we have another type, we call it capillary vessels, which interconnect the vein to the artery. Artery usually colored red, usually red, very red siya. Yung sa vein usually medyo bluish yung color. Okay, so this is the capillaries. Okay, So the two general types of blood vessels that can develop abnormal enlargement will be the arteries and the veins. Usually, hindi nag-enlarge yun, capillaries. And what are the differences between the artery and the veins? Okay. Some of you know this from basic education. Okay. So in terms of function, artery transports blood from the heart, ito yung red ito, okay, from the heart to the organs, palabas. Okay? Whereas the veins transport blood from the organs, okay, sa periphery, going to the heart. Now, in terms of thickness, mas makapal yung artery, mas manipis yung vein. And then in terms of elasticity, mas elastic yung artery, mas less elastic yung vein. And then in terms of size of lumen, medyo mas maliit yung artery compared to the vein, usually. And then in terms of presence of valves, ito like this, mga valves, na, walang valves yung artery. So one direction lang. Okay? And then, dito sa mga veins, may mga valves yan, no? Maliliit. No? Then in terms of pressure, mataas yung artery, kaya pag may dumudugo na sumisirit, no? Nakikita natin sumisirit, usually artery yon. No? Okay. Now, the pressure in the vein is very, very low, kaya parang gumagapang lang yung dugo, nagsisip lang, no? Okay. And usually bluish, no? A little dark red or bluish in color, okay? So these are the differences between the arteries and the veins. So the question is, ano itong type of abnormal enlargement that can occur in the arteries and the veins? For the veins, when there is an abnormal enlargement, we usually call it varicose veins. For the artery, we call it aneurysm. Ito aneurysm, no? Ito yung nasa aorta ng abdomen, no? Pag lumaki abnormally, no, aorta, we call it aortic aneurysm, no? Now, parang balloon siya, no? Okay, when it in terms of enlargement, it appeared like a balloon, like bulbs. And then sa veins naman, usually enlarged, bulging, twisted, and tortuous. No? Iba yung itsura, no? Kasi very thin ang wall ng vein, no? Kaya ganun ang itsura. So these are pictures of varicose veins. No? Okay. Twisted, tortuous, enlargement. Usually bluish ang kulay. No? So what are the different types? I like to say that per se, varicose veins are just enlarged twisted veins. So this is the generic definition. And they mostly occur in the lower extremity, like the feet, like the legs, and the thighs, sa baba, no? Usually. No? Okay, but strictly speaking, varicose veins can form in other parts of the body. Okay, examples will be the hemorrhoids, esophageal varices, and varicoceles. No? So when you have hemorrhoids, it's essentially a varicose veins. No? Okay. So kasi we define varicose veins as enlarged twisted veins, no? But commonly it's being used doon sa paa. But when you see an hemorrhoids, example ito hemorrhoids, no? Internal hemorrhoids, dilated yung mga veins dito, malalaki, no? Tortuous, no? Okay. So essentially, these are varicose veins, but we call it hemorrhoids, no? Ito naman, so deep inside the esophagus and also the stomach. Okay, usually kung may sakit isang tao, you can have esophageal varices, no? Okay, ito yung nagkokos ng mga pagdudugo, no? Okay, sinusumusukan ng dugo, no? So these are varicose veins in the esophagus and the stomach, no? But usually we call it esophageal varices. Now, varicoceles naman, ito naman, these are varicose veins inside yung scrotum, no? Ganito. Dilated veins din ito. So mga testicular veins. So essentially varicose veins din ito, but we call it varicocele. No? So different technical terms. So when speaking of varicose veins, as I said, we commonly refer to the tortuous, permanently dilated veins of the superficial system due to the pooling of blood in the lower extremity, like the feet, legs, and thighs, and seen under the skin surface. So this is the definition of varicose veins as we commonly use it. No? So we usually use, when you say varicose vein, we usually refer those veins, dilated veins, in the lower extremities. As I said, yung mga varicocele esophageal varices, saka yung hemorrhoids are also, strictly speaking, varicose veins. No? Okay. And usually ang involved dito, yung the so-called superficial venous system. As we shall see later on, doon sa legs, there's such thing as superficial venous system and also the deep, yung malalim, deep venous system. So ang nagdadilate sa varicose vein sa paa is the superficial venous system. So ito yung difference between the two, superficial venous system and deep venous system. As I said, there are these two systems there. So, okay. So superficial veins are usually ating skin. So andito yung superficial venous system. No? Okay. So deep inside, doon sa may muscles, doon sa ilalim, no? This is the so-called deep venous system. Okay. Okay. So usually, pag may problema dito sa varicose veins, yung blood, instead of going in to the deep, no, yung blood nagpupull doon sa labas, sa superficial. Okay. So here you have this picture of the veins that are commonly involved. No? So there are two major superficial veins in the lower extremities involved in varicose veins. So you have the long or the greater saphenous veins as well as the lesser or short saphenous veins. So ito yung long. Long kasi mahaba, no? Pababa. From the, just sa singit, pababa ng pababa, up to the leg. No? This is the long saphenous veins. Okay. Whereas the short saphenous vein, hanggang sa ano lang, sa may knee area. No? Okay? At the back of the knee, hanggang dito sa paa. So this is the short saphenous veins. Okay. So what are the causes of varicose veins? Essentially, it's the most common cause is a weak or damaged vein walls and valves. No? Okay. So veins, as I said, have one-way valves inside them that open and close to keep the blood flowing towards the heart, papunta sa puso. So weak and damaged valves or walls, the walls of the vein, in the vein, can cause blood to pool, mag-ipon-ipon sa baba, hindi nag-flow, and even flow backwards, na pabalik. So example here, ito yung normal vein. So sabihin natin ito sa paa. Na? Okay. So the vein flows from here, paa, papuntang puso. No? So dadaan siya sa may mga valves. So yung valves mag-open, so paakyat ng paakyat. No? Okay, that's the normal blood flow. But if there is a varicose vein, usually yung valves, no, ito, yung nagba-backflow na yung dugo. So kasi defective yung valve, no? Defective yung valve. Dapat one direction lang, paakyat. Pero kung defective ang valve, there'll be yung blood flow is pwedeng bumaba, pabaliktad, no? Okay? So magpupul yan dyan to the point that magdadilate yung weak na vein. No? So usually nasa superficial vein system kaya kitang-kita through the naked eye. Okay. So another illustration here. So the blood flow in healthy saphenous and perforator veins, ito yung superficial vein. So paakyat one direction, usually papasok sa super deep vein, paakyat papuntang puso. No? Ngayon, kung may problema again sa valves, no? Okay, instead of ito yung deep, no? Ito yung superficial. So there are mga incompetent valves, no, that will cause dilatation, magpupul kasi yung blood, kaya lalaki, magdadilate yung mga blood vessels, no? So magbabulge yan through the skin kasi manipis lang yung balat, no? Okay. Another illustration, this is the deep vein, this is the superficial part. Okay, ito yung one-way valve. Okay. So usually importante kung sa paa, yung calf muscles ang nagpa-pump, no? Yung mga muscles doon sa may sa leg yung nagpa-pump, no? Kaya importante, this may implications sa mga exercises to prevent varicose vein. Dapat matibay yung calf, no? Yung muscles, no? Okay. So dito, makikita ninyo, damaged valves, instead of going this way, bumabaliktad, nagka-counterflow yung blood paloob, papuntang deep vein. Dapat palabas lang, one direction lang dapat dito. Okay. So the other causes, ito yung most common cause, weak or damaged veins, walls, and valves. The other causes will be if there is increased blood pressure, yung pressure dun sa vein, such as may tumor, nakakompress dun sa vein, sa mas mataas. Sabihin natin, may tumor dito, mag-obstruct yun, hindi siya makakadaan. Other risk factors will be the age of the patient, then sitting or standing for a long period of time, then inactive lifestyle with no exercise on the leg muscles. So importante talaga yung ina-exercise yung leg, yung muscles, yung calf muscles. And then the other one is if you have a positive history of varicose veins, siguradong tatamaan ka. No? Okay, I mean, malaking chance na tatamaan ka pa rin. No? So you have to be careful in how to prevent it if you can. No? Okay. So how to recognize or diagnose varicose veins? Okay. Madali lang ito, just by looking and seeing. So ito, kitang-kita na. No? So these are mga dilated veins, kitang-kita. Once you see this, varicose veins na yan. No? So ito, severe na ito. Diba? So ito, maliliit pa lang. No? Ito, nasa sa paa, sa legs, sa ankle. No? Ito, nasa legs na ito. No? Pwedeng isa lang, pwedeng kabilaan. No? Okay. So bulging, tortuous, bluish vein or veins, marami, on the lower extremity is a diagnostic sign for varicose veins. So madali lang i-diagnose. So what are the different stages of varicose veins? Nagde-develop yan over time. So yung usually ang pinaka-mild yung sa mga spider veins, maliliit lang ito, parang spider webs. No? Okay. Then reticular veins, they call it the reticular, ganito, mas malaki ng konti, no? Pero not as bulging as the usual varicose veins. And then ito, pag nagbabulge na talaga, halatang-halata na, so you can have varicose veins, you call it varicose veins now, no? But sa ngayon, there are 3 stages dito. May skin, may ulceration na, yung isa may skin damage na, yung isa wala pa. Okay, 3 stages, no? So I'll show you pictures of the 3 stages. So ito may varicose veins, dilated tortuous vessels. Dito meron nangingitim na yung balat, no? Because of stasis, nagpupul kasi yung blood, hindi umaakyat, no? And then ito may sugat na, may skin ulcer. Okay, so this is the late stage. No? So ito, another picture, a clearer picture here, may sugat na siya. No? Okay, ulcer. So in the patients with varicose veins with no skin or damage, again, there are different degrees. Yung mild, you can call it mild, moderate, or severe. And then they can appear in the same leg, both legs, or just one leg. Pwede yun. No? So iba-ibang stages. No? So another example, ito, wala pang skin changes, pero medyo mild lang ito. Ito, medyo severe na ito. No? Okay. And this one occurring in 2 legs na. No? Okay. How does a physician evaluate varicose veins? So usually physician determine whether, kung nakita nila varicose veins, as I said, madali mag-diagnose ng varicose veins, di ba? So they try to determine whether there is an external cause, such as obstruction or external compression of the venous system by a tumor. Kung merong bukol, nag-obstruct doon, then the only remedy is to remove that tumor. Kung pwede, kung matatanggal. No? Kung cancer or tumor na matatanggal, tanggalin. No? So para matanggal mawala yung varicose veins. The other thing that the doctor usually do, they determine kung wala itong external compression, they determine, usually mga weak veins na yun, no? They determine whether there are modifiable or remediable causes, such as prolonged standing and lack of exercise, for which measures can be done to reverse or to prevent the progression of the varicose vein. Okay. So kung nakita nila isang pasyente na may varicose veins at ang alam niya, ang history, palaging nakaupo, walang exercise, then they will ask the patient, iwasan niyo na umuupo ng matagal at mag-exercise kayo. Okay? And hopefully, it will reverse, or usually, pag severe na, usually irreversible yon, but at least it can try to prevent the progression. Wag lang lumaki. Okay? So the type of treatment is dependent on the cause, which could be evident or probable. So ito example, this one is caused by a tumor. Ito is not caused by a tumor, but a weak, baka congenital, baka this, inherent na weak ang veins at weak ang valves. No? Okay. So another thing that the doctor will do is to determine whether the varicose veins are caused by weak veins, damaged valves in the superficial perforator or deep veins, and whether there is a problem with the deep vein system. Kasi that will determine the specific treatment. Okay? So, i-determine ng doctor kung superficial veins lang ang may problema, or including the deep veins, kung may problema, or kung may valves ang sira, or just the weak veins. Okay? And then they also determine the severity. Okay, whether it's spider, reticular, varicose vein, without skin damage, with skin damage, and ulcer, because the treatment will be dependent on these factors. What are the diagnostic tests being done prior to treatment for varicose vein? As I said kanina, just by looking, pag nakita niyo may tortuous veins, usually madali nang mag-diagnose ng varicose veins. No? Okay, kung wala, baka talagang wala, or may beginning varicose vein. Okay? But usually, kung duda yung doctor na kung may varicose veins o wala, hindi siya obvious, then they can do diagnostic test. But usually, pag gumagawa ng diagnostic test yung mga doctor, usually obvious na yung varicose veins. No? Okay? So, ita-testing na lang nila kung nasaan ang problema. Okay? Kung nasa valve or nasa weak veins lang, but usually kasama na yung valves. No? At whether the deep veins is involved or just the superficial vein. So the diagnostic tests that are being done will be these physical tests of the legs, such as tourniquet test. When say physical test, yung yung manual lang, by looking, by manipulation, without any machine, without any device. No? Now the other type of test will be using a machine already, ultrasound. They call it venous Doppler ultrasound of the leg. Okay. Now, ito pinaka-common. Originally, nung wala pa yung ultrasound na machine nito, usually the doctors use the physical test. No? Okay. Wala namang masyadong gastos dyan. No? Okay. But because of the inaccuracy of the physical tests, like the so-called Trendelenburg birds, Perthes, tourniquet, I'll show you some examples of this. Usually, it's Doppler, venous Doppler ultrasound that is being done nowadays. Okay. Pero kung nasa rural area ka, walang venous Doppler, then the doctor can still use the physical test. So ito yung example ng physical test. No? So they put tourniquet here. Pwedeng i-milk yan muna, put the tourniquet, and then let the patient stand kung mag-appear yung mga varicose veins. So then they determine whether it's due to the problems in the valves or problems in the superficial vein, problems in the deep veins. Another example here. So minilk na niya, patakit na yung mga dugo, bakit na. No? Then they put the tourniquet. Okay. And then they watch and see kung magpupuli yung mga blood doon. So the venous Doppler ultrasound of the leg is a non-invasive test that uses sound waves. As we said, ultrasound is usually sound waves to look at a blood flow through the valves in the vein using a handheld device, a transducer, which is about the size of the bar of the soap against the skin over the body area being examined. So the transducer transmits the images of the veins in the legs to a monitor, nakakabit sa isang monitor yan, which will display the results. Okay. So the Doppler will help with the detection of varicose vein. As I said, kung may duda, you can use the varicose veins kung di siya halatang halata. And then it can also be used to identify the causes as well as the severity. Okay? The causes, as I said, pwedeng just weak veins or combination of weak veins and weak valves, and which one is involved, mostly superficial, but kung yung deep veins are also involved, then treatment might be more complicated. So what are the treatment options? Okay. So after reviewing all the information by the doctor, history, physical exam and tests, and ultrasound results, the physician decide and recommend which leg vein treatment could be effective. So meaning, magpipili siya, magre-recommend siya among the different types of treatment. So ang implication nito, maraming types of treatment that will have to be selected. So sometimes more than one type of treatment and more than one session, I will expound on this later on, okay, will be recommended to give the best results and reduce the side effects. Okay. Minsan, one treatment session lang, like yung injection, baka it needs 2 or 3 treatment sessions. And then yung mga surgery na tinatanggal, nire-remove varicose veins, baka isa lang. No? So, the treatment for varicose veins may include self-care measures, okay, which is present in all types, which should be done in all types of varicose veins, kahit na malala, para wag lang mag-progress. Then compression stockings are usually done for all types of varicose veins. And then it can also include surgeries or procedures. So basically self-care, compression stockings, and then surgeries or procedures. So the selection will be dependent on the stages of the varicose veins. Okay. As we mentioned, spider vein, ang treatment nito medyo magaan, no? Reticular vein. Pero the moment you have varicose veins with skin ulcers, mas mabigat, mas complicated ang treatment. Okay. So the procedures can be, when you talk about procedures, self-care can be done in the house, in the home, no? Compression can be done. But when it comes to surgeries and procedures, no, it can be done as an outpatient procedure, which means one usually goes home on the same day. You don't have to be hospitalized, but some may need hospital confinement, such as when the so-called procedure called vein stripping is recommended. Hihilain talaga yung varicose vein, tatanggalin. Usually you need a more complicated, sophisticated anesthesia procedure, and therefore you need to be confined. So talking about self-care, self-care will include exercise, raising the legs when sitting or lying down. So para yung mga dugo ma-facilitate bumalik sa puso. Okay? Avoid prolonged standing or sitting, and then wearing compression stockings. Okay, all of these can help ease the because kadalasan may pain din ng varicose veins and may prevent them from getting worse. Okay, so exercise, raising the legs, no, avoids prolonged standing and sitting. Pag nakaupo rin tayo matagal, nagba-varicose veins tayo kasi naiipit yung mga flow of blood upwards to the heart, no? Then wearing compression stockings. Compression stockings, okay? So you may have to wear compression stockings all day, okay? And this could be often the first approach to try kung may varicose veins ka, especially mga maliliit pa, okay? So maliit na varicose veins. The stockings squeeze the legs, helping vein and leg muscles move the blood more efficiently upwards towards the heart. So recommended stocking, hindi lang elastic band-aids, but usually may mga commercial na compression stockings na may grading, may mga different pressure. No? So usually ang pressure is, okay, so increasing pressure sa baba, then sa taas, mas magaan ang pressure. Okay. So the procedures, the surgical procedures, okay, that are being done for varicose veins include the following: sclerotherapy, laser, catheter-based procedure using either radiofrequency or laser energy, then high ligation or vein stripping, and then ambulatory phlebectomy. So I'll explain this one by one. So when you talk about sclerotherapy, so it includes the following: a solution or a foam is injected into the varicose veins, which scars and closes the veins. Parang when you say sclerose, parang sinasara, sinisira yung wall para dumikit, no? Kaya magsasara yung ano. Okay. So in a few weeks, the treated varicose veins should fade, should decrease. Kasi wala nang blood, medyo collapse na, no? So the same vein might need to be injected more than once. Ito yung sinasabi ko, baka kailangan ng another session, 2 sessions, 3 sessions. Okay? So sclerotherapy doesn't require anesthesia, no? Usually isang injection lang. O kaya kumisan, baka yung mga topical lang, kung natatakot yung pasyente sa mga injection, topical anesthesia lang muna, and then inject yung sclerotherapy. No? So it can use it's usually done in the clinic. You don't have to be hospitalized. So the reported cost is, hinanap ko yung mga cost nito. So it ranges from 3,000 to 4,000 per session. So baka kumisan mas mura because of the competition of all the clinics, kasi maraming dermatology clinics, other varicose vein clinics na nagpo-compete for customers, for clients. So they compete with the prices. Okay. So ito yung illustrations on how sclerotherapy is being done. So ito yung varicose veins. So a needle is inserted there. Okay. And then ini-inject yung solution. No, ito yung sclerosing solution, and then ito kumakapal na, nagpa-fibrous, nagko-collapse na. Okay, so nag-collapse na siya. Okay, okay, so wala nang dugo na dadaan dyan. Sarado na yan. Okay, so you won't be able to see the bulbs already. So that's the effect of the sclerotherapy. Now, laser treatment, yung laser lang sa labas, wala yung ini-inject. Kasi there's another type of laser treatment. May catheter ini-insert sa loob, sa vein, and then ina-apply ng laser therapy. So, but this one is just an external one. So laser treatment sends strong bursts of light into the vein, which make the vein slowly fade and disappear. So no cuts, no needles inserted. Okay, medyo attractive ito. Okay, outpatient procedure. Okay, but right now I don't have the quotations on how much it will cost. Okay. Now the other procedure is may some catheter na inserted, and then you can do either radiofrequency or laser therapy. Okay. So this procedure is usually preferred treatment for the larger varicose veins. Okay, not for the spider veins, not for the reticular, okay. So for the varicose veins without skin damage, or kung saan may skin damage, pwede pa. Okay? Okay. So it might be the preferred treatment before yung considering the yung stripping, mamaya i-explain ko. No? So how this is being done, a thin tube catheter is inserted into the enlarged varicose veins, and at the tip of the catheter, it's heated using either radiofrequency or laser energy. I'll show you the pictures here. As the catheter is removed, the heat destroys the vein by causing it to collapse and the seal shut. Okay, there's a sclerotherapy. It's the medicine, it's the drugs that destroy the wall of the veins, make it collapse. Ito naman, it's the heat that makes it collapse. Okay. So again, it can be done as an outpatient procedure. Patients do not have to be admitted. So the reported cost is from 70 to 80,000. Mas mahal ito. Okay. So ito yung picture ng catheter using radiofrequency. So ito, isasaksak yung catheter into the varicose vein. Okay. So nasa loob na yung catheter sa varicose veins, and then may at the tip of the catheter, may mga filaments dito that will transmit the radiofrequency waves dito. Okay. So habang nilalagay yon, then konti-konti, titingnan nila kung magpo-collapse na yon, then hihilahin, unti-unti, hanggang lumabas yung patanggal yung catheter. So the end result is ito, magko-collapse na yung vein. Okay. Wala nang blood na dadaan dito. Okay. Closed vein na siya. Now, ito naman, laser. Yung kanina, laser without catheter, ito may catheter. So ganun din, just like the radiofrequency treatment, may catheter, and then deep inside, idadaan yung laser. No? Okay. The other type of procedure that can be done is the so-called high ligation and vein stripping. Ito yung history-wise, ito yung pinakauso noon. No? But in the advent of the laser, in the advent of radiofrequency, and also the catheter na may laser, mas common na ginagawa yon. Ito, bihira na ginagawa. No? Unless hindi kaya ng pasyente yung cause of the yung mga laser. No? Okay. So high ligation and vein stripping, this procedure involves you tying off a vein before it joins a deep vein and removing the vein through a small cut. Okay. Example, ito yung varicose veins. Okay. Ito yung long saphenous vein, papasok dito sa deep vein. This is the femoral. So may hiwa rito, and then i-isolate yan, ikakat lang yan. No? And then, yung dito, kasi i-strip ito, tatanggalin na ito. So may isang stripper, idadaan dyan, iti-thread, then hihilahin hanggang matanggal yung buong varicose veins. So yung veins, buong tatanggalin. No? In contrast to yung mga sclerotherapy, in contrast to the radiofrequency, andun pa yung vein, pero collapse. No? But this one, ini-strip na yan, tinatanggal mo. No? Okay. So ito, example, andun yung stripper. Usually may isang parang hook, no? Then hihilahin para sumunod yung buong varicose veins. Now, the last procedure that is being popularized nowadays, kung pwedeng iwasan yung high ligation and stripping, or this can also be done as a complementary procedure kung may natitira or nag-recur in varicose vein at may maliliit na lang ang natitira ng varicose veins, then you can use the so-called phlebectomy. Phlebectomy means removing of small veins. No? Otomy is tanggal. No? So removing smaller varicose veins through a series of small, tiny punctures. Yung mga maliliit punctures. No? So ito, puncture dito. Okay. So only part of the legs that are being pricked are numb in the outpatient. So ito, ilalagay ng anesthesia lang, then ipasok, konting cut, maliit ng cut, then pasok isang hook, no? Hooking the varicose veins. So ilalabas doon sa maliit na butas, no? And then ika-cut off ito. No? Okay. So kumisan hinihila nila, then kumisan may series, hahabulin niya isa-isa. So may cut dito sa baba, may series of cuts, marami yan. No? Pero hindi siya halata. No? So since malilit lang yung butas, no? Ito mga butas lang yan, maliit ng cut, so scarring is minimal. Okay? So this just shows that ito yung mga possible outcome of treatment. Ito mga maliliit, nawawala yung varicose veins. No? Okay? Ito, after a successful treatment, halos nawala na. Okay? So what is the prognosis, inclusive of recurrence after treatment of varicose veins? Usually, varicose veins are not dangerous, and they don't cause long-term health effect, usually, a majority. Most people with this condition are concerned with the way varicose veins look. Usually, pangit tingnan, di ba? Kaya minsan, di miniskirt, hindi maka-shorts, no? Nakapantalon palagi. Okay. So they may experience discomfort also kasi yung blood na pupul sa baba, no? Medyo mabigat. Okay. But they don't usually develop complications. Okay. So varicose veins tend to get worse over time. Pero pag hindi mo ma-support ng gusto with compression, stocking, with exercise, with avoiding prolonged standing and sitting, no? Then mag-worsen siya over time. No? Okay. So some ill consequences, but these are very rare. As I said, the late stage is skin damage, may skin ulcer, okay? And also blood clots. Kung saan magka-clot yan, okay? There is no cure for varicose veins except those which are caused by compression, by tumor compression. No? Tatanggalin mo na yung tumor, matatanggal. No? Pero yung mga weak veins, usually inherently weak yon because of aging, because of hereditary gene, mga genetic predispositions. So walang cure talaga yon. No? So just a matter of supporting it para hindi lang siya lumaki. Okay. So even after surgical removal, recurrences may occur. So ang tinatanggal lang naman kasi yung mga nakikitang varicose veins. Yung ibang veins na natitira, pwedeng umulit. Kaya, kasi hindi naman tatanggalin ng buong venous systems, di ba? So may talagang may chances na umulit yung sa ibang lugar. What are the preventive measures against varicose veins, if there are? So, number one, suggestion is to keep a healthy weight, huwag masyadong mataba, exercise regularly, avoid prolonged standing, also avoid prolonged sitting still, palaging nakaupo na isang position lang, so tatayo-tayo, okay? Putting your feet up while sitting, kung pwede, intermittently, at some intervals, huwag palaging prolonged sitting, and then, not wearing tight clothing, no? Para hindi ma-compress yung veins sa baba. Okay? Some recommended exercise for varicose veins would be the following. So walking, madaling gawin, bicycling, kung pwede, no? Stationary biking, pwedeng outdoor, pwedeng indoor, okay? Leg lifting, lunges, and then rocking the feet, calf muscle exercise. I think this is the most important, calf muscle exercise. Calf raising. I will show you pictures of the more complicated exercise. So I think leg raising. So you can do 10 reps, 20 reps a day, okay, daily, okay. And then lunges, parang nag-genuflex ka lang, okay. So ito yung nako-compress yung mga calf muscles, di ba? Okay, saka sa legs. No? So it tends to promote, to facilitate in blood flow from the feet going to the heart. Rocking the feet. Okay, so while standing or sitting, you just rock the feet back and forth from heel to toe. Madali lang yon. So pag nakaupo kayo, wala kang masyadong ginagawa, may iba-ibang iniisip nyo, so you just rock your feet, no? Okay, para to promote yung blood flow going up and down, no? And then, ito yung calf raising. So, just stand and then tiptoe ka lang, no? So, do mga 10, 20 times, no? So, stand up calf raising. Ito pinakamadaling gawin yata, no? Okay. So, myth on varicose veins. So, the most common myth that we have heard is that if you cross your legs, you will get varicose vein. Okay. So, it's not true. Okay. Varicose veins, as we know, aside wag lang yung caused by the tumor compression, are usually the result of weakened or damaged valves. No? So crossing your legs does not lead to weakened or damaged valves. Another myth is that when you do exercise, it will make your varicose veins worse. Hindi. No? Exercise is only good for it's not only good for your overall health, but it's also good for your veins. Okay? So walking and running causes your calf muscles, yung leg muscles mo, to pump more blood to your heart, which gives your circulation a great boost. Okay, so pwedeng mag-exercise. Okay? Wag lang excessive, of course. Okay? So, varicose veins can be treated with drugs and herbal medicines. Ito yung maraming naniniwala, maraming nagma-market dito, no? So, gamot lang, herbal, okay? So drugs and medications can relieve pain and inflammation lang, but not the varicose veins per se. So as we know, the cause of the varicose veins are the weakened veins and damaged valves. No? So pwedeng stockings, pwedeng i-compress to help the veins para hindi siya palagi nagpupul, you can put stockings. No? Okay, but not the drugs. No? The drugs hanggang pain lang and inflammation. So I think that's the last slide. So summary and takeaway, I have discussed all these topics. I think these are comprehensive enough for today. Okay. And then takeaway in relation to patient empowerment, be always in touch with reliable medical information on varicose veins. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on varicose veins in your health management. So with that, I end this pep talk on varicose veins. I hope I have empowered you to have an essential or better understanding of varicose veins in your health management. So before we go to the question and answer portion, let's reminder, please take the OLETE. This 50 OLETE certificates, 1 voucher for ROJoson telemedical consultation. Okay. Feedback, please type in your feedback on the chat box. Okay. During the open forum, then let's now have a group picture taking. Okay. Ready? Everybody's. 1, 2. Okay, how about 1? Okay, kompleto na. 1, 2, 3. Good. First time I have a complete picture. Okay. So the floor is now open for questions, comments, recommendations, suggestions, and also consultations, quick consultations. Okay. I will try to answer kung kaya ko as best as I can kung may consultations. So how many of you have varicose veins? I hope wala.
Doon ako meron, spider.
Spider. Okay, gano'ng katagal na, Kat?
Noong 2019 po, bago ko, nag-apply ako ng trabaho. Tapos sabi nung sa medical, sabi niya, bili ka na lang ng compression stocking. Tapos yun lang po, para makaalis ako, bumili ako.
Para makaalis ka. Okay.
Oo, kasi kailangan ng compression stocking kasi titingnan nila. Hindi sinuot ko na ng matagal. Lumiliit naman yung ugat, kaso nung umuwi ako ng Pinas, hindi ko na siya nasusuot. Parang dumami yata, feeling ko. Sabi na kapatid ko pag nakatalikod ako, parang dumadami daw o lumalaki. Hindi ko sure.
Okay, pero hindi exercise ang recommend sa'yo?
Nag-exercise do, kaso ano,
Tamad.
araw-araw kasi ako naglalakad eh. Pag, siyempre,
Hindi, lakad okay lang. Basta may exercise ka pa rin.
okay na.
When you say exercise, yung exercise to strengthen your calf muscles. Yung talagang naka-focus na to pump kasi nasa paa yung yung varicose veins mo, di ba? Nasa legs na. So, you do an exercise that will talagang kasi exercise can be anything na ang effect noon is yung buong katawan, di ba? Pero you can do exercise naka-focus doon sa paa mo para to strengthen the muscles of your legs para to help pump the para to strengthen also the blood vessels, yung veins doon sa legs mo, na gano'n. Okay. So yung mga tinuro ko kanina, yung leg leg lifting, no? Gano'n. Then calf raising, madaling gawin 'yon, no? Okay.
Do, kasi po yung high school ako, paggubad ko na sapatos, binabasa ko yung paa ko kasi pumapasok na ako sa trabaho nung time na yun sa Divisoria. Nagiging cause ba yun ng varicose? Hindi naman. Paggubad ko kasi sapatos, ganun ako dati.
Okay. Is that a myth? Baka myth na yun. Ngayon, pumupulot ako yung myth. Palay ko myth yan, di ba?
Ayun po kasi sinasabi ng kapatid ko, dahil daw sa gano'n.
Kaya nga, is that a myth? Can I ask the others? Have you heard of that? Can we consider it as a local myth?
Yeah, it's a local myth.
Okay.
Also yung yung sabi nila, yung pag nanganak ka daw, after you gave birth, lalabas yung varicose veins mo daw sa legs.
Yeah. Okay. So I will react to that yung pregnancy, no? Pero yung sa kamay, yung sa paa, yung nababasa. Parang pasmado, gano'n, di ba? Pag karon, ano tawag doon? Pag hindi mo pwedeng basahin ang kamay mo, no? Baka maging pasmado.
Tapos, oo.
Okay. So yung sinasabi ni Kat naman, pag nagtanggal ng sapatos at ibabad sa tubig, yan nagkakos ng varicose veins, no? So that's a myth, Kat, no? Okay. So, okay, hindi totoo 'yon, no? Okay. So what is really lacking is yung strengthening of the vein, no? By exercise dun sa paa, no? Okay. Pero kung minsan kahit anong gawin mo, kung talagang because you have a genetic predisposition, wala tayong magagawa, na? Okay. So parang aging na yun, wala tayong magagawa, na? Doon sa pregnancy naman, it's true that may compression. Kuminsan yung malaking uterus, baby, na nagko-compress sa veins, na? But they are usually temporary. Temporary lang dapat yon. Pag nanganak na, nare-release na yung pressure, na? Okay. Unless talagang prone to varicose veins yung babae na yon, no? Okay. It's more of a congenital na. Okay, congenital predispositions, no? Okay. So dapat i-exercise talaga, no? So if you want to avoid something, just best effort lang, exercise, na kung di makakuha sa exercise, wala ka nang magagawa. It's really part of your destiny na. Okay. Okay. Okay.
Is it also the same as long standing and long sitting will cause varicose veins?
Yeah. Yung long standing kasi 'di ba may gravity pababa, na? Okay. Yung long sitting naman, palagi ko naiipit yung 'di ba? Pag yung bend dun sa cilia, no? So naiipit yung flow ng blood towards the upper part of the legs, no? Okay. So mas maganda if you avoid long sitting, kasi long sitting, aside from the predisposition to possible varicose veins, marami ring problema sa long sitting no? Kung minsan sasakit talaga yung balakang mo, no? Kung matagal ka nakaupo, di ba? Or ano pa yung mga yung edema, di ba? Yung paa, no? Kung minsan lalaki yung magsuswell ang paa mo rin, no? Kasi nakaipit, no? Ganon. Okay. So avoid long sitting also. Long standing and long sitting. Ako ang ginagawa ko, okay, I want to share my personal experience, no? Okay. So there was a time several years ago, hindi ko maintindihan bakit masakit yung balakang ko. Now, after a while, I discovered kasi because of prolonged sitting. So I shifted to, when I'm talking to you now, delivering my talk, no? Ano sa palagay nyo? Nakatayo ako, nakaupo?
Tayo. Nakatayo.
Nakatayo ako, nakaupo?
Nakatayo.
Sitting down.
Nakaupo.
Sitting down.
No, nakatayo ako.
Nakatayo.
Okay. So, I usually do my computer work nakatayo, no? Okay. So, meron akong isang stante na mataas, and then my computer is dito, at my level, no? And then, I spent several hours, paano mo i-balance yung avoid prolonged standing, di ba? Prolonged standing can also cause edema and also varicose veins, di ba? Okay. Pero since pag nakaupo ako na matagal, talagang sumasakit ang balakang ko, no? Okay. So, ang remedy doon, nung tumatayo ako palagi, no? Computering, no, writing, no, nakatayo ako palagi, no, okay. Parang mataas yung isang table, I use the isang cabinet na mataas, then pinatong ko lang doon ako nagta-type, no, gano'n, no. So nawawala, no, yung pain ko sa balakang, no. Pero ang fear ko, because of prolonged standing, baka mag-edema naman yung paa ko, mag-varicose veins, di ba? Okay. So I usually do exercise to avoid it. So every day meron akong squatting exercise aside from those that I mentioned. Nag-squat ako 50 times a day. 50 times. Aside from walking. So napansin ko, nakakatulong yun. Ibabalance ko lang. So to the end, I concluded that pinaka-importante dyan is exercise of your legs mo. Okay. So aside from varicose veins, it will avoid your edema, di ba? Laging kino-complain ng mga pasyente, namamaga ang paa ko, di ba? Walang varicose veins pero namamaga. Again, because mahina kasi yung flow ng veins. No? So dapat i-exercise yung legs, no? To avoid yung edema. Yung fluid nag-accumulate doon eh. No? Okay. Okay. So, is that a raising of hands? Recuenco? Wala. I thought. Pointer ko lang pala yun. Any question?
Doc, pag po may varicose vein, ano po yung usually pakiramdam ng legs? Yun po bang pangangalay?
Pwede. Nagpupull kasi yung blood doon eh. No?
Kasi po yung kapatid ko, gano'n, yun lagi ang inaano niya sa akin pag pero may varicose vein po talaga siya, kita ko. Pero lagi po niyang inaano sa akin na pagkagaling niya sa work, yung pong nangangalos yung legs niya, yung parang laging ngalay. Kaya ang ginagawa niya, pinapamassage niya dun sa anak niya. Pwede ba po yung gano'n? Hindi ba po yun bawal na pag po may varicose vein, minamasahe yung legs?
Hindi naman. Kasi usually, pag pinamasahe mo, somehow, ina-exercise mo yung muscle doon, di ba? Yung sa paa. No? Sa may hip, sa may legs. No? But, from my experience, yung mga masahe is not very effective. No? As effective as exercise. Exercise na mag-squat siya. Pag nag-squat, kinocontract mo yung leg muscles mo. No? Okay.
Saka yun nga din, Doc, medyo mataba siya. Kaya sabi ko, baka gawa rin yung weight niya. Kaya siguro kailangan, yung gawa nga nun, kailangan siguro
sabi mo
din.
sa kanya, mag-exercise siya. I think that will be the best solution. Exercise, saka decrease the weight, of course. Okay. Pero mas importante yung exercise. No? Okay.
Thank you po.
Regular, regular exercise. Okay. So, any other questions?
Can varicose veins cause cramping?
Pwede. Pero kahit na kasi walang varicose veins, nagka-cramp kasi, no?
Ayan.
So, up to now, hindi ko I myself cannot identify yung trigger for cramps, no? Yung daily cramps that we have, no? Sabi nila, due to electrolyte, kumisan hindi eh, no? Okay, due to kumisan, I usually have cramps almost every morning pag natutulog ako, no? So I usually stand up lang, and then after that nawawala, no? Okay. So I don't know whether it's the medications that I'm taking kasi may maintenance ako for hypertension, no? Or napapansin ko basta before sleeping, konting exercise lang yung paa ko, no? So mukhang nalilesen, no? Yung incidence. Pero walang guarantee rin. Kung saan talagang bigla na lang magka-cramps. So up to now, up to now. Okay. Yeah, Shirley. Unmute. Yeah, good. Unmute. Question.
So, when you collapse the vein, basically you make the vein useless, tama?
You
make the vein,
yung sa treatment? Yung sa treatment? Yeah.
When you collapse the vein, so the vein now is useless, right?
Yeah, kasi nakadikit na siya.
Okay. So yung treatment ang part ng leg or whatever part na dependent on that vein is lessened also. Wala nang blood supply kasi, right?
Meron pang deep system. Yung sa deep.
Kaya pa din.
Ah,
So,
kaya pa.
I'm more concerned with, rather than cosmetic, is the functionality. Yung later on, you have, maganda nga skin mo, pero malnourished naman pala that area. I'm just having that question.
In a way, that's true. Pero small chance lang na talagang magiging dysfunction ka because meron ka pang deep vein system no? May deep vein pa, no? Yung deeper part yung sinabi ko, yung located within the muscle, no?
Inner.
Pwede pang yun ang channel going to your blood, to your heart, no? No? So ang affected lang yung mga nasa superficial, yung just directly underneath the skin, no? Okay.
Okay. Yes. Thank you, Doc.
You're welcome. Very nice. Good questions.
Dr. Can the phloem? Can the phloem help? Can the phloem help?
The phloem is more of
The phloem.
that's why I said yung kanina myth yon, no? Kasi a lot of patients, no? Because of the marketing, it's more for the pain, temporary lang yon, pain and inflammation, no? Okay. Pero pagdating doon sa varicose veins itself, yung dilated ng veins, hindi niya mapapalit yon. No? Okay. So yung mga Dapplon also being used for, kadalasan ginagamit sa hemorrhoids, di ba? Hemorrhoids, no? Pangkalmante lang yon, no? Okay. But the hemorrhoids still there, no? Okay. So the only way to decrease the size of the hemorrhoids is not the medicine itself, but yung avoid the constipation. Avoiding constipation, probably you can say it's similar to putting stockings, compression stockings sa paa. Di ba? Okay. So you cannot put compression stockings sa puwet, di ba? So you just avoid constipation na lang. Okay? So thank you for those questions. Kung minsan napapaisip din ako na ko. Ito bago ko lang naisip, no? Compression stockings sa puwet. Pareho lang sa yan. Na avoiding constipation, na ang katumbas noon. Okay. Yeah, Shirley. Shirley or Mary?
Mary.
Okay, Mary.
So, Doctor, when Hirodoid is applied to supposedly varicosis, wala ring effect talaga. Hirodoid. Hirodoid cream.
Hirodoids? Yeah, wala rin.
Yeah.
Ano yan? Anti-inflammation lang yon. Pangtanggal lang sakit lang. Okay, so actually you don't have to use the Hirodoids, you don't have to use Dapplon. I-ano mo lang, i-rest mo lang yung puwet mo. Rest means mahirap na sabihin na huwag ka dudumi, di ba? When you say rest. So ibabad mo lang sa mainit na, maligamgam na tubig. It will have the same effect. No? After moving your bowel, no? Ibabad mo lang o buhusan na maligamgam na tubig, yung a little warm water, no? Okay. Or what I usually do, I also have hemorrhoids. Fortunately, it's not increasing in size, no? Ang ginagawa ko lang after defecation, basta I make sure, of course, you wash it muna, no? You put mo, and then I usually put a tissue paper and then push the yung bukana, push it inside, na? Okay? Yan ang trick ko. I don't know whether it really worked or not, no? Pero sa ngayon, it's not I know I have hemorrhoids. Hindi pa ako, I have not come to the point that I have to be operated on, no? Ganon. No? Okay. Pinupush ko lang papasok. Kasi the moment
Naka-warm.
Doc,
naka-warm and cold alternating may help.
Well,
after poo-poo, warm water, cold water.
No, pag masakit lang, if you feel pain. No, if you don't feel anything, this is my personal opinion. Okay, so if you want to decrease the aggravation of your hemorrhoids, if you have hemorrhoids, no, or if you want to avoid it, i-push mo lang palagi, papasok. Okay? Kasi ang hemorrhoids is actually varicose veins na maliliit, no? Okay, pag lumaki, bababa siya eh, di ba?
Yes, talakas sa ano.
Nagpo-prolapse. Eh kung palaging naka-prolapse, no? And then yung sphincter mo iniipit, so pababa lang siya pababa.
Painful.
Kumisan, initially it's not painful, pero lalaki na lalaki, no? Okay, naiipit eh, di ba? So itulak mo na lang sa loob.
Yeah, I should have that done for mama.
Can you check my theory? Yan ang my personal practice.
Try it, Doc. We'll try it with my mom.
You try it. No? Ano, kung may hemorrhoids kayo, itulak nyo para ano. Kasi marami ako nakikita ng hemorrhoids nakaluwa na, nakababa na. No? Ang hirap na ibalik, di ba? Okay, we usually operate on those, yung nakaluwa na talagang hindi na bumabalik. Na? Okay.
And how effective is surgery sa hemorrhoids?
Just like varicose, yung hemorrhoids matatanggal yung bulging, yung mga nakaluwa, no? But we usually don't remove everything, no? Kasi when we remove everything, ang kapalit noon, magko-constrict yung puwet. Kasi wala na yung yung pliability ng yung mucus, yung red, na? Kasi pag tinanggal mo lahat, skin ang kapalit, di ba? Pag skin, hindi siya pliable eh, no? Okay.
And harder for defecation.
Yeah, magiging makipot naman, makipot. So usually we don't remove all. Now, we just retain some para wag lang hindi siya bothersome to the patient. Na? Okay.
Thank you, Doc.
Thank you for those questions. Very stimulating. Okay. Okay, any more?
And I think avoiding spicy foods will also help.
Oh.
sa hemorrhoids?
Hemorrhoids, yeah, I think so.
Varicose.
Because I don't know.
Hemorrhoids? Usually there was mukhang myth na yun eh. Mukhang myth na. No? So I think last time I lectured on hemorrhoids, diba? I think I mentioned that it has been proven that when you eat spicy food, it's not the real cause for the hemorrhoids. No? Okay.
Obstruction.
Pero there are still other people who believe that eating spicy foods can cause hemorrhoids. No? Okay. Okay.
You're necessary for CA.
Any more questions? Do we have newcomers here? Will compression stockings help varicose veins? Yes. No? Ito yung may tanong si Cuenco. Okay. So, kasi yung when you say help, no, it will help in the sense that it will compress the yung veins in such a way that the blood will disappear and go up to the pocket going to the heart, di ba? Okay? Iko-collapse lang yan, no? Okay? So, it's in that sense. Wag lang, it will help in the sense na wag lang magkakaroon ng prolonged pooling of blood in that vein, kasi with prolonged pooling of blood, lalaking vein. Di ba? Okay, so in that way, compression stockings help. No? Okay. But compression stockings will not make a varicose vein disappear. Kung meron na, kung may varicose veins ka na, no? It will not make it disappear. No? Okay? It will just try to avoid its, para hindi lang ma-aggravate, hindi lang siya maging mas lumaki. No? Ganon. No? So baka exercise pwede pa. Exercise pwede pang habulin ng konti. Habol-habol. No? Okay. Yung compression kasi mechanical lang yan eh. Iniipit mo lang, di ba? Parang tinatali mo lang. No? Okay. Any more?
We're not a doctor when you're a child.
So,
Huh?
I see a new, si Recuenco I know. Si Ningli, if you don't mind, then can I welcome mga newcomers here. Ningli, who is Ningli? Ningli? Okay.
Yes, Dr. Joson.
Yeah.
I'm the sister of Mary.
Okay. You use a name.
Yes, I've been
Ningli.
trying to to join your meeting last Saturday, but I'm not high tech, so I had to ask my daughter to help me.
Yeah, okay. Now that you are in, I won't change the template. Madali na ito. I've been doing this for the past 2 years, di ba? So, yung template, madali na pumasok, di ba? Okay. So, I'm now back to using the account of UP. Kaya wala nang interruption ngayon. No? Okay. Kasi last two times nag-i-interrupt tayo, di ba? Okay. So, I will not change the template. It will be the same. Para medyo madaling pumasok. No? Okay. Thank you. You have any question, Ning?
No, I heard what you have shared this afternoon.
Okay, it's already 3:20. If there are no more questions, we will call it a day. Okay, just message me for any topics that you want me to discuss, but I still have, I already have some lineup of topics. I still don't know what topics to put priority on next week. So, kasi hinahabol ko rin yung DOH calendar month. No? Okay. So, it could be how do I, thyroid, pwede, no? Thyroid, or how to take care of surgical wounds, no? Yung mga, kasi maraming questions yun. Bawal maligo, bawal mabasa, di ba? Yung mga wounds, no? So, I might talk on that, no? And, ano pa ba? Others, no? I'm still preparing for others, no? So, but if you have any special topics that you want to request me to talk about, I will consider them. No? Okay. Okay, just message me. No? Okay. So if there are no more questions, we'll call it a day. We will see each other next week again. Okay. Okay.
Thank you po.
Bye-bye.
Okay,
Thank you,
Doc.
Doc.
Thank you. Bye.
Bye-bye, Doc.
Bye-bye.
Bye.
Bye.
Okay po.
Okay po.